This is Syncope semiology presented by Dassi SchrDbb with reference a practical guide to history taking and clinical examination by Anwar Qais Saadoon. Hello, I'm going to present now on syncope. So what is syncope? Syncope is just the term fainting. Fainting is the community term. Syncope is a medical term. So it's a temporary or sudden loss of consciousness and postural tone due to temporary loss of consciousness and postural tone. For postural tone is much more of an atonic seizure, because we have different type of seizure. So when you have just a loss of postural tone without consciousness, you can think of an atonic seizure. But mostly for syncope is sudden loss of consciousness. Okay, due to a cerebral hypoperfusion, usually lasting no longer than 1 to 2 minutes. Basically. So the syncope can be divided. We have autonomic syncope, which is due to a vasovagal syncope, which can be vasovagal syncope, may also be referred as neurocardiogenic syncope. It is most common type in children, that's vasovagal syncope. The second is cardiac syncope, mostly related with arrhythmias, with a Stokes-Adams attack, when you have a tachyarrhythmia resulting to reduce perfusion in the brain. But it also can occur due to left ventricular outflow obstruction in cases of an aortic stenosis. If you have a left ventricular outflow obstruction, aortic stenosis, you may have a cardiogenic syncope. You have non-cardiac. Non-cardiac may be due to neurologic etiologies. You have seizures, migraine, hyperventilation, panic attack, or self-induced metabolic disturbance, hypoglycemia, and or hysteria. So we have syncope. Syncope, we have identity. So when you want to take the issue taking syncope, you should take the identity as age and sex. You have chief complaint. Chief complaint, you have fainting, blackout, you have passing out and transient loss of consciousness. The issue of present illness. What was the child doing before the event? What happened immediately before the event? These questions are so it's very important for syncope. What was the child doing before events? What happened before event? Was the event witnessed? It's better to see the event. And if the event was witnessed, you have to talk about the eye movement. If there is eye rolling, you think of a seizure instead of a syncope. If there is abnormal movement of the limbs, you think of a seizure rather than syncope. So we have duration of loss of consciousness. Typically lasts for 1 to 2 minutes. Now you have to speak here. The time of the day when the syncope occur. So it can, or the presence of the prodromal emotions, nausea, headache, warmth, diaphoresis, lightheadedness, palpitation, auditory or visual changes, blood vision. The symptom typically lasts for few days, so for few seconds before the loss of consciousness precedes. The time since the last meal, because you can think of hypoglycemia as being the cause of the syncope. That's a non-cardiac cause, as you have seen here, or hysteria being the cause of syncope. So we have associated symptom, palpitation, you have chest pain, you have abnormal movement can occur in pre-syncopal period or with syncope, cyanosis, pallor, urinary or fecal incontinence. Were there any residual syncope after the syncope, e.g., headache or prolonged disorientation? Past history, you have prior episode of syncope, a history of breath holding spells, that's cyanotic breath holding spell or dead spells. You can think it's a past history. It can make syncope occur. You have a congenital heart disease can make syncope occur. Epilepsy can be differential of syncope, migraine, anemia, and other. So you have medication history. If there is a medication, you give medication that prolong the QT interval. Prolongation of QT interval can cause tachyarrhythmia. and tachyarrhythmia may result to a syncope if the tachyarrhythmia is greater than 150 beats per minute. Like in the case of, you have erythromycin can cause tachyarrhythmia, you have clarithromycin can cause tachyarrhythmia, you have amiodarone can cause tachyarrhythmia by the prolongation of those QT interval. Actually, if you have prolongation of QT interval, you can have a form of heart block, but to compensate this heart block, you have tachyarrhythmia in case of in form of a dorsal de point tachyarrhythmia. Are you getting? So this is when you have a prolonged QT interval, and when prolonged QT interval is particular characteristic of a hypokalemia. Prolonged QT interval is a particular characteristic of a hyperkalemia. Is it clear? So we have immunization history, we have recent a prolonged QT interval is a particular characteristic of a hypokalemia. It's a particular characteristic of hypokalemia. Hyperkalemia much more present with a heart block, while hypokalemia present with a tachyarrhythmia. So we have immunization history, recent vaccination, we have feeding, dietary history, hereditary history of diet, how much the child drinks in a day on average, your family history of seizures and all that. So now the key point to note here, a family history of sudden death or cardiac disease or palpitation, syncope, I've already told you, you have to think of a cardiac dysrhythmia. So if you have a family history of sudden death, you think of cardiac dysrhythmia. I have also spoke about a cardiomyopathy. So mostly hypertrophic cardiomyopathy is a family issue of sudden death, palpitation, syncope. If you have a family issue of stroke, family issue of cardiac ischemia, you instead think of a familial hypercholesterolemia. One, think of a thrombophilia, familial thrombophilia. So those are the things you have to think of. Syncope on standing is orthostatic hypotension, which is a vasovagal attack. So if this occurs, the occurrence of syncope with activity is idiopathic. If you think of syncope in activity, you can think of idiopathic hypertrophic cardiomyopathy, like in the case that happened to our player in Cameroon, Foué. Foué had an idiopathic hypertrophic cardiomyopathy. That's why when he was playing football, suddenly he then failed. Are you getting? And then he had a sudden idiopathic hypertrophic cardiomyopathy. So let's have a small memory for Foué. Let God bless him. So a relatively quick, that is few seconds to 2 minutes return baseline of mental suggests syncope, while delayed return mental status may suggest a seizure rather than a syncope. You have seizures such as atonic seizures. And atonic seizures, you don't have any movement. Are you getting? You just have a seizure, and you may have a loss of consciousness. Are you getting? And it usually occurs for more than 2 minutes. If it's more than 2 minutes, you can easily suspect a seizure less than a syncope. Is it clear? So an anemic child is more likely to have syncope due to reduced cerebral oxygen delivery. Now we have sore throat. The next one is sore throat, our disorder. So thanks for your kind attention.